patient that I speak to will say, I spoke to my doctor and I asked, can I go off A, B, C, and D? And the doctor says, speak to your pharmacist. In our training over here, we get told, speak to your doctor. So the poor patient is the one stuck in the middle. And that is a big foundation where we've worked from, both where we found this massive gap, where whether it is how to take the medicine or whether it is how to stop the medicine, we've really found that the knowledge we have, learning more, catching up on a lot of things has been able us to help in that arena. And I constantly get people asking, like in my work, I can't sit and discuss this kind of functional medicine with them, but people are always looking for a platform. And that is why this became such a burden for us, and to a point where we cannot be quiet anymore. We have to talk.
Hi, Yvette. So here is episode number 1 of our brand new podcast, From Pills to Purpose.
Hey, Johann.
What an exciting day.
It's very exciting, nervous, exciting, and definitely something we've been working towards.
Absolutely. But I do feel everybody has a first day. Everybody had an episode number 1. So here we are. We just give it our best and let's see where it takes us. So to start off with, Yvette, thought a little bit about introducing ourselves. So I'm first going to put you on the word because ladies first. My mom taught me that I should be a gentleman.
So to tell you a little bit about myself, I am currently a pharmacist. It feels like I've been a pharmacist my entire life, close to 40 years, and practicing in a clinical position where I currently do some counseling for patients and advise them. But through the years, it has also led me and Johann to find something a little bit deeper and more purposeful. So we are also functional medicine practitioners. That is very dear to our hearts because if you know a pharmacist, you know that we like to help. You know we like to give people advice. So currently I'm working for a company where I do clinical counseling for patients, but my heart is really with a functional medicine practice. We're aiming to help people to live a better life every day, and exactly the same as what our logo is, that we call medication reduction specialists. And that really comes to our heart of where we want people to do well, not necessarily take more medication, but you be able to take less to get good results. So
Absolutely.
in a nutshell, that's where I am now, and that's what I want to be able to impact people's lives.
Yes, like Yvette said, we're both registered pharmacists, and I work in the retail setting where I see people at the counter every day. And just knowing from our background, and we figured out that medication is not the answer. It does help, and we are not here to bash the medical profession or our profession or our employers or whatever the case may be. We are purely here to bring value and to tell people a little bit of our experience, what we see every day, and what we've found that there is a better way. Because we've seen people taking prescription medicines and guess what? They come back every month. Every month they come back for more. And if it's not long and they go back to the doctor and the doctor switch it up, because now they have side effects for these medications. So instead of changing the medications, doctor gives them something else to help them with the side effects. And before you know it, they're on 10, 20 different prescription medications, and they come to the pharmacy counter asking, how can I get off of these? Now, we believe that the prevention is the cure, and that is the reason why we also became functional medication practitioners, because there is a better way. And to a little bit about ourselves also, we also studied pharmacy at the same school in South Africa. And you can hear from our wonderful accents, we are not Americans. We're semi-Americans because we've been living here for over 20 years already. But the school that we studied at is called Potchefstroom University for Christian Higher Education. And I feel, and you can chime in, I feel that really gave us a different perspective as to people who studied at maybe a secular school where they did not have the Christian background in the school as such. Because one thing that, remember, we talked about our what they was called subject philosophy, that class. that stupid little class that we felt is so unnecessary. But now, if we look back, that was really a backbone from where we are today.
That was honestly one of the most rewarding classes looking back. It absolutely grew our perspectives. It grew the way we looked at things out of a worldview. And that really, if I think back to anything, I think back to that class. The whole philosophy and what our approach should be as pharmacists. Yeah, I like what you said there. We always used to think, oh, this is such a stupid little class. Why are we attending it? But I must say, I think I was one of the few students that did not miss a single one of those because it was so absolutely fulfilling. And to basically get a bit of a Christian view on what is your impact as a pharmacist. So we both found that very uplifting. It really taught us a lot.
Yeah.
So Johann, you want to tell us a little bit about when you studied, where you came from, and how you ended up there so that we can share some similarities?
Yes, well, my journey, I remember my a family member got really sick, and I was still a little, I would say probably 13, 14 years old. And I felt at that point, I just wish there was something that I could do. And this is a man problem because men always want to fix everything. Sometimes if your a lady friend tells you her problem, I had to learn that in marriage, that she doesn't necessarily want you to fix it. She just wants you to listen. So it took a while for me, but wanting to fix and help people is something that comes from a really long time ago. So I first thought I want to become a doctor. That was my number one thing because I felt that if I become a doctor, I'd be able to help my suffering family members when they get ill. And things did not work out that way. We went to high school, and to get into medical school in South Africa, they only take the cream of the crop. It's only the very best high school students you have to have all A's, and I was not an all A student. Sorry. But anyway, so in the end, I decided to go to the army. And I went to the army, met a few pharmacists and doctors, and I spoke to both of them and ended up thinking, you know what, I really like the idea of becoming a pharmacist because a pharmacist is still in a position to help those people with real needs, but you're not on the clock 24/7. So at the end of the day, you punch out and you go home and you're off, and you don't have to work these crazy 24-hour shifts in an emergency room. So that sounded a lot more appealing to me. So I thought that way I can have the best of both worlds, still being in a position to help people, and then also being able to have a little bit of free time for me and my family. So after the army, I wrote letters to the pharmacy school, to the Potchefstroom University, and I applied and I got in. I still think it's a miracle from above that I got in because, like I said, I was not an all A student, but I never regret a single day of going to pharmacy school. That was probably one of the best things that I've done at that point.
Well, that sounds awesome. And I now realized when I was counting that I've actually been in the pharmacy business for 45 years. So I started when I was 2, just for everybody so they could know. My story is very similar to yours in the way that I had my mom's aunt got multiple sclerosis. And my dad was in the hospital for close to 6, 7 months with rheumatic fever when I was a young child. These things honestly intrigued me, and the medications and what they used for my dad. I had these books at home, and I would always look up and see what it is. And lo and behold, my parents' best friends owned a pharmacy. So from when I was 13 years old, I started working for him in the pharmacy. I was very interested in going to medical school, but after I visited the medical school and they went through the cadavers with the dead bodies, and I'm like, no, this is not going to be me, can't do that. So I immediately applied for pharmacy school. And Johanna, I think it's could be a man problem as well, but it could also be a personality thing because I've always wanted to help people. From a young age, when people weren't feeling well, I would read up, like, so what do you need? What is short? So there's always been that hunger. You also got to realize, the two of us come from dinosaur years where information wasn't so freely at hand. You either had to buy a book, go to a library. You didn't just get the information. There was nothing like that. So going to pharmacy school was honestly one of the big things for me to how can I address future family issues and health issues? Because I saw the impact that had on a family. I must say, and Johann and I did speak about this, and we'll speak about it more later in detail. Going to our pharmacy school, it always felt the first year you asked yourself, what am I doing here? Because they were doing everything except dealing with people's health issues, but it was an exceptional foundation so that we could grow to the point where we were and being so knowledgeable in many areas. And, becoming a pharmacist and then starting to work as one, that is kind of like the realization, what you were saying earlier, Johann. Patients come to you month after month, you refill the same prescription. Are they getting any better? And for a very long time, I lived in that oblivious world where I thought this is the way to do it. But when somebody close to you comes and asks advice and saying, I'm not getting any better. No, in fact, let's say, for example, I'm more suicidal than I was ever before, or they're going to have to do A, B, C, and D, maybe amputate my leg. And that's a couple of times when those things stop you in your tracks and you're thinking, okay, I helped up to this point, but how could I have prevented that? With the knowledge and the background where we came from, eventually evolved into what we call the medication reduction specialists. And our hunger and desire to help current people, but also to prevent anybody from going down that same road. I feel that that has played a very big impact in who we are, what we do, how we approach people. Now, a
I do.
question I want to know. Okay, go ahead.
I also want to just reiterate, we talked about it a little bit earlier. Those first few years in pharmacy school where you think, what the heck is this? Because they open your mouth and they shove down all these science facts down in your throat, and you feel like, this is not pharmacy. What the heck is this? But it built such a foundation that we actually now, doing functional medicine, revert back to those first sciences, because that is the basic principles about how our bodies work. Because if we don't realize that our bodies have a mechanism in it that is actually going to heal itself, like if you cut your finger in the kitchen, if you just rinse it off and put a Band-Aid on without any ointments or stitches or anything, it will heal by itself, because the wisdom is already in our bodies in order to tell our bodies how to heal. And it's not just throwing another prescription drug on it. It's throwing another prescription drug on it. So that first few years, I feel, was such a foundation for what we're doing today in order to help people and really make them not just feel better, but get them off of numerous drugs.
I think one thing that we have in common, and we've spoken about this a lot, is you touched on it a little bit earlier, is when a person gets a certain medication, due to the side effects, they get another one and then another one. And then in my practice currently working with clinical things, I would ask somebody, why are you taking this? And so many times it's to mask the side effects of something that they took first, second, or third. So again, we both say that there's a place for medication. There definitely is. But the amount of questions and requests that we both get on how can I reduce the amount of medication I take? Because I know A, B, C, and D is causing diarrhea. I know that I would be able to sleep better if I changed this and the next thing. But people find themselves at a loss, because where do you go? I see it every day when a patient that I speak to will say, I spoke to my doctor and I asked, can I go off A, B, C, and D? And the doctor says, speak to your pharmacist. In our training over here, we get told, speak to your doctor. So the poor patient is the one stuck in the middle. And that is a big foundation where we've worked from, both where we found this massive gap, where whether it is how to take the medicine or whether it is how to stop the medicine, we've really found that the knowledge we have, learning more, catching up on a lot of things, has been able us to help in that arena. And I constantly get people asking, like in my work, I can't sit and discuss this kind of functional medicine with them, but people are always looking for a platform. And that is why this became such a burden for us, and to a point where we cannot be quiet anymore. We have to talk.
Absolutely. And we do want to throw out a little disclaimer. We're not here to tell you to stop, start, or change any of your medication regimens or whatever you do with the healthcare right now, you have to discuss that with your doctor that you have a doctor-patient relationship with. But what we can do is to tell you what you can do to support your body in healing itself. So, and when you do those things, I can guarantee you that your doctor is after a while going to say, you don't need this anymore because symptom X, Y, and Z has fixed itself. But it's not really fixed itself. You did do the work and you gave your body the right things to overcome the problem. But really, there is things that you can do to improve your health tremendously.
You and I have spoken about that for a long time with regards to certain medications. I don't want us to go down, discussing specific drugs, but over the years, we were taught with certain medications that you, for example, have to change your diet first, or you have to add something in. And one thing we both noticed is when we do speak to patients, because that's part of our training, when we do a counseling for a patient, we always have to ask, were you advised, to change this, add this? And I think we can both testify that that doesn't happen anymore.
True, absolutely. And many doctors I know will tell patients you have to change your diet, change your lifestyle. But that is not the easiest thing to do. And for the doctor does not have the time to sit there and consult you for 30 minutes in giving you the what we would call next steps.
Yes.
Okay, do this type of exercise, don't do that type of exercise, eat this type of food, don't eat that. They don't have the time to sit down, so they just tell you quick. If they can tell it to you in one sentence, that is their time, worth their time. But it's not worth their time to sit there for a half hour to consult you in how to do a lifestyle change. But that is why we are here, because we
Now
do have that time.
that's what we've seen make a big difference. Spending that little bit of time explaining, putting, like you were just saying, putting a little bit of meat around that statement that says, eat better and exercise more. And most people will go, okay, and you walk out there. So, and again, I agree with you. I don't blame anybody in the medical profession, because if you know how payment structures work, if you know how their turnaround goes, that is why I said there's such a huge gap where we can absolutely fill in the blanks, really help people, give them advice. And again, it comes down to the one thing that Johann and I are very much in favor with. If you give your body the right components, it'll heal. I think over the years for us, looking at the results we've had with people and seen how much that impacted it, it makes the two of us really giddy and excited, because we know it can impact a whole lot more people.
For sure. For sure. And I feel, sometimes your pharmacist at the pharmacy might not have the time to also sit with you, but there might be time. So go talk to your pharmacist and see if they're willing to spend a little bit of time with you in what to do with your healthcare situation. A pharmacist is such an untapped resource that you can have. But I don't want to throw pharmacists under the bus when they're really busy. So don't go to them 4 o'clock when everybody gets off work. That's the wrong time. Go ask them when would be a good time for them to sit down and go over this with you. But I feel being a pharmacist is something that provides me with so much joy. And Yvette, I also think people who are interested in one day becoming pharmacists, I think we need to give them a little bit of advice.
And so true, because our platform is there for existing pharmacists like ourselves that feel the need to bridge the gap. And what you were saying there, there's a lot of young people that they have this idea, I'm going to go to pharmacy school. And I think the number one question that people have asked, and that always breaks my heart, is when you ask them, why are you going to pharmacy school? Oh, I'm going to make a lot of money. When I hear that, the first thing I want to say is turn around, run around, go back, go do anything else. Because if you're going to do it for the money, not for the love of helping people, you're in the wrong place. Johann, you being in retail, you can give a young person a little bit of an idea of what it's like.
Yes. It might seem to a young person out there that it is such a prestigious job. But I want to tell you, if you don't do this job out of love for people, I always call it the PP, the passion for people, then you will be very unfulfilled in this job. If you think you're going to go to pharmacy school because you want to make lots and lots of money, like Yvette said, it's the wrong profession for you. You can go study and get your degree as a pharmacist, but go in the industry. Go and be a CEO of a pharmaceutical company or something. That's where you'll make money. If you want to actually work with people behind the bench or like Yvette on the phones doing clinical stuff, it can be very fulfilling, but definitely not because you get paid exceptionally well.
It's
But
for the love of people.
absolutely. I can tell you, if you have this passion for people and you want to help people, that is such a right place for you, because there's so many people that we see nowadays, and especially the elderly. And I want to say nowadays, in where we live, very underserved when it comes to medical and healthcare, because so many people come to us and they can't find a primary care physician. They're on waiting list for primary care physicians. They have to go to urgent care if they have any medical need. And so they come to the pharmacist to ask advice, to ask what they should do next, because they can't get into a doctor. And to give you one quick story, just a little story about what happened in a pharmacy where I worked at. There was a man, I'm in California, and there was a visitor from New York. And very friendly man, he walked up to the counter and he said, no, he feels he needs to take some Tylenol or something because his shoulder hurts. And from your training and from being inclined with a passion for people, you start asking questions. And I said, well, did you injure your shoulder? No, he didn't injure his shoulder. He says, but right as I'm standing here and he touches his left shoulder, his shoulder really hurts. I said, sir, it might be nothing, but my suggestion is you chew an aspirin, you go to urgent care right now. It's across the street, you don't have to go far. And he said, no, it's just something. I said, please do me the favor. Rather go to them and have them tell you that it's nothing than when you walk down the street and you drop dead from a heart attack. And that caught his attention. So you talk to so many people that you forget people's faces. And I mean, this incident, he walks out your door and you don't expect really to see him again. He's from New York. He's going to get on a plane and you won't see him again. So a month later, this guy comes in and he walks from the back of the counter. He keeps pointing at me. I thought, here we go. I did something wrong. I'm in trouble. So I came up and I said out loud in front of everybody, you saved my life. And it reminded me of that incident. And he went to the urgent care. And sure enough, he was actively busy having a heart attack and they saved his life.
Wow.
So in instances like this, and I wouldn't say it happens every day, but you're in that prime position as a pharmacist to help someone and to save someone's life. So for that reason, if you want to provide that value to people, being a pharmacist is probably really the place for you to be.
That's a fantastic story and a very good example, as you and I have both worked with other pharmacists who would shun people off and say, go get a Tylenol.
Yeah.
And I always find that also being a believer and asking the Holy Spirit, in certain situations and instances where there's an inclination for me to dig deeper, I ask that every day. I pray, should I ask? Because if there's any kind of thought that I need to ask more, then I follow that. And I think that was an instance where you followed that guidance, knowing that something else is going on. And I think in that part, for anybody that wants to go to pharmacy school, or even people who are currently pharmacists, if you don't have that passion for people, you don't have that desire to help them, then, look for other avenues. Go find something else. There's a lot of other jobs that make a whole lot more money. But working with people, I must tell you, it's the good, the bad, and the ugly. I had my own retail pharmacy back in South Africa, and I had an armed robbery. It was the person tried to stab me with a knife, but something took over and I was able to defend myself. And believe it or not, it happens here in America as well. So there's a lot of things that go into it, and the desire and the want to go back again tomorrow because you know there are people there that you can want to help. So for anybody that's young out there wanting to do that, this is just a bit of information so you can think about it and ask the right questions. But for
Yes,
you and me, Johann, it has really impacted our lives in many ways. Also, probably because we would never have met. We both come from South Africa, but we didn't
studied at
know
the
each other.
same pharmacy school.
We went to the same school, but we met in America. So believe it or not, there's more than one reason that we're very thankful to becoming pharmacists and moving to America.
Yes, definitely. Well, I think we're nearing to the end now, but we'll continue on with episode number 2, and I think episode number 2 we'll talk a little bit more about functional medicine and how we transitioned from regular allopathic medicine, like our podcast says, from pills to purpose, to helping people with a myriad of wellness conditions and really improve their lives. And pills are not always the answer. We're not here to shun pills because they do help in many instances. But for when it comes to chronic lifestyle conditions, lifestyle is the only thing to really cure it.
I want to end off with saying this is something I have told patients for many, many years. And again, just to strengthen the point, we're not here to tell people to stop drugs, to take, no, that's not what it is. But the one thing I tell my patients every day when they call, I absolutely recommend and I highly honor them for the fact that they are asking the right questions. And I make people aware that ultimately you are in charge of what goes into your mouth. And if you are starting to ask questions about medication, I know there's an older generation that thinks the doctor goes home at night and sits and worries about that patient. I think we've gone totally past that generation. And I always remind patients that you are ultimately in charge of your health. You are the one that's going to benefit from that. You are going to be the one that benefits from asking the right questions and being able to understand what's going on in your body. And with that said, I think that is where my foundation comes from for helping people, getting from pills to purpose, understanding why they're taking things, and maybe getting to the point where they don't have to take some.
100% agreed. And you'll feel better when you start taking care of your health.
You will, for sure. Looking forward to episode 2, Johann. We have lots
Yes,
to talk about, and I think it's going to be fun.
absolutely. We are going to continue this trend and hopefully people can move from medicated to motivated. Take
Very
care,
well said.
everyone.
Take care. Cheerio.
The views and opinions expressed on this podcast are our own and are intended for educational and informational purpose only. This podcast does not provide medical advice, diagnosis, or treatment. The information shared should not be used as a substitute for professional medical advice from your personal health care provider. Always consult your physician, pharmacist, or qualified health professional before making any changes to medications, supplements, or health regimens. We are also promoters of Neolife nutritionals, beauty, and household products, and this stems from our knowledge of their purity and the company's reputation to provide products of outstanding quality. While we may discuss our experiences in the retail pharmacy setting and share insights into functional medicine, our conversations reflect our professional perspectives and personal opinions, and not those of our employers, affiliated organizations, or licensing boards. By listening to From Pills to Purpose podcast, you acknowledge that you are responsible for your own health decisions and agree that the host and guests are not liable for any outcomes resulting from the use of the information discussed in this podcast.